Put your fingers on the inside of your wrist. Hook the pulse check. I do it like this. Count the beat for 30 seconds. Don't miss. Pay attention to the rhythm. Could be AFib. A lot of people around the nation dealing with atrial fibrillation. Some of us are confident, very optimistic. Go see a doctor. Don't be a statistic.
When it comes to the heart, don't really know where to start. So important to the body, I'm talking about every part.
I noticed that I was becoming more tired than usual and sometimes dizzy, but I ignored it. Then one day, I was walking my granddaughter to school. I got really lightheaded and I had this weird offbeat rhythm in my chest, fast and wrong. That's when I noticed that it was something going on.
It was scary. We didn't know what was happening. We knew it wasn't normal.
Atrial fibrillation, or AFib, is a medical term for having an irregular heartbeat. Imagine a DJ playing a beat. The beat has a rhythm, and the rhythm is predictable. Imagine that beat going off tempo, becoming irregular, so much so that it's impossible to find the right dance moves to it. It becomes chaotic. That is similar to what's happening to a person's heartbeat who has atrial fibrillation. When the heart fails to contract properly, blood begins to pool and stagnate in the heart chamber. Stagnating blood causes clots to form within it. Those blood clots can end up traveling to the brain, causing a stroke.
I ignored the many signs, the fatigue, the dizziness, and the skipping of my heart like it was freestyling without warning. And although my family has a history of high blood pressure, I didn't think that something could really be wrong. But my angel persuaded me to get checked out.
First, I thought it was stress. But it was upsetting seeing Auntie too fatigued to even take her granddaughter to school or take her to the playground. So I encouraged her to see the doctor.
Atrial fibrillation, or AFib, is a silent killer, especially in communities of color. Its incidence is rising. It's becoming more common and also more undiagnosed. What are some of the atrial fibrillation risk factors? High blood pressure is one, diabetes is another, sleep apnea, heart disease, obesity, thyroid disease, and there's certain behaviors that can increase our risk for atrial fibrillation, heavy alcohol consumption, as well as smoking. Atrial fibrillation increases the risk for stroke by 5-fold. A 5-fold increase in the risk of stroke if you have atrial fibrillation. So atrial fibrillation can cause many, many different types of symptoms, but it's important to know that sometimes atrial fibrillation can cause no symptoms at all. There are some symptoms that we see commonly in individuals with AFib. One of those symptoms is the feeling of palpitations, fluttering in your chest, the feeling that your heart is racing away, dizziness, just a sudden lightheaded feeling, the feeling of pressure in your chest, or even chest pain. Other symptoms include shortness of breath, especially on exertion. But remember, some people have no symptoms at all. Trust yourself, know your pulse. If your heartbeat feels irregular, call your physician, get checked. By doing so, you might end up saving your own life.
I went to the doctors and they diagnosed me with AFib. But I have a treatment plan. I'm on a heart-healthy diet. I take medication and I stay in constant contact with my healthcare providers. And I take my pulse regularly, at least once a week. I want to know what's really going on with my heart I pay close attention so that I can stay active with my family.
It is so important to understand that atrial fibrillation is not only easy to diagnose. You can begin with a pulse check, and it can end with an EKG or another type of heart monitoring procedure done at your doctor's office. So it's relatively easy to diagnose atrial fibrillation. And yet, atrial fibrillation is eminently treatable. We can treat the irregular heart rhythm itself. We can treat the rapid heart rate. We can even treat the blood clots that are forming in the heart that are increasing the risk of an individual stroke. Taking care of your heart is everything. It's a form of love for yourself. It's probably the reason why the heart is a sign of love. So loving yourself means taking care of your own heart. By taking care of your own heart, you have the ability to take care of your loved ones even better. Your heart has a rhythm. You should learn it.
Ready to get to know your heart? Join us in the next video. We'll show you exactly how to check your pulse and recognize the irregular rhythm found in AFib. We'll see you there.